In this video, I'll demonstrate how to do a sterile dressing change on a subclavian central line. The frequency that these dressings are changed depends on the policy of the facility, but typically it's once a week and more often if needed. As with any IV procedure, strict asepsis is crucial, and in this case I will also be using sterile technique to prevent infection and possible sepsis. So I have already identified my patient and washed my hands. The equipment that I need is a sterile dressing change kit, which has a sterile clear dressing, a Tegaderm. It has an antiseptic wipe to clean the area. It has sterile gloves and a mask for me. I also need an extra mask for my patient to wear so they don't contaminate the site by breathing on it. I need non-sterile gloves to remove the dressing. And many facilities use what's called a BioPatch, which is a foam disc that is impregnated with an antiseptic to also prevent infection, and that goes around the entrance site of the central line. So I'll show you how to put that on as well. Okay, so I will open my sterile dressing tray and flip my sterile BioPatch onto the tray. And then I can put my patient's mask. So I would want to explain to my patient why they were wearing the mask. And this patient obviously has no face and no ears, so we won't put the mask on, but you would on a real patient. Right. Subclavian central lines are usually sutured in place with single sutures, but I still need to support the cannula as I take the dressing off so that I don't tug on it. So, first I need to put my mask on. And the BioPatch can come off, the old BioPatch can come off with the dressing. And wash my hands again. The kit does come with sterile gloves, but I know from experience that these run small and rip easily, so I always bring an extra pair of sterile gloves in with me. I have a sterile drape I can use. With this antiseptic, you just pop the wings and squeeze it, and the antiseptic gets in the sponge. And you want to do back and forth with a lot of friction, and that helps the antiseptic impregnate impregnate into the epidermis easier. Okay. And then you want to wait till the antiseptic dries, which in a human is about 30 seconds. On a hard plastic mannequin, it's much, much longer. So I'll just use the sterile gauze to dry the area. You would not do this on a human. My new bio patch. You want to make sure that the blue side is up and that the slit in it, the edges touch. Okay, now I can put my dressing on. I'm going to need to sign the date, the time, and my initials, but I'll put this on first. You want to smooth it out so that there's no wrinkles in it. And then this dressing, it's nice, it has a label right on it that I can use. Wash my hands. And label it with my initials, the date, and the time. Often when we change the dressing, we also change the saline locks on the end, but I won't be doing that for this video, but you simply make sure that it's clamped off and you remove the old ports and put new saline locks on.